Hi everyone, I'm Chesca Colloredo-Mansfeld. I'm the co-founder and executive director of MiracleFeet. I'm thrilled to be here today, so much to learn from so many of you. I'm here with my colleagues Andrea, Norris, and Christy, who hopefully you'll all get to meet, but we can't wait to get your feedback, ideas, and discover lots of ways that we can partner with you. I'm going to start by illustrating what we do with a little story of a kid called Alan. MiracleFeet works on clubfoot, which is an issue that many of you may not have heard of. I'm going to try to demonstrate why you need to hear about it and why we need to fix it together. Alan was a child who was found living on the streets with his mother. He was taken into an orphanage, and you're going to see a little picture of what he looked like when the orphanage brought him into the clinic, followed by a clip of what he looked like 4 months later, having had treatment. Here he is, he's coming in several years after the treatment, and he's running into the arms of the couple that have adopted him. So this is about fixing feet, but really it's about transforming lives. Clubfoot affects 1 out of every 800 children born worldwide. Incidence rate is thought to be similar across all countries. But because of where kids are being born, 90% of children born with clubfoot are in low and middle income countries where there's very limited access to treatment. In the US and in other developed countries, clubfoot is routinely addressed at birth, which is why many of you haven't heard of it. If you're born with a disability in a low income country, as many of you know, there's incredible stigma and marginalization associated with it. Kids with disabilities tend to be at risk of neglect, higher risks of physical and sexual abuse. They tend not to be able to go to school and have very limited employment opportunities. So these children are really facing a very downward spiral. The wonderful thing about clubfoot is it's totally curable, totally fixable. And with a treatment that can be delivered anywhere in the world, it involves serial casting followed by a very small medical outpatient procedure. The whole thing takes between 4 and 6 weeks if you get the child when they're really young, and works in 95% of cases. It costs us $250 to treat a child. So Alan's life was completely transformed with a treatment, simple treatment over a number of weeks at a cost of $250. The way MiracleFeet is addressing this issue is really important. We're working to build local capacity. So we work with local orthopedic surgeons and physical therapists who primarily are in public and charitable hospitals. We come in, build capacity by providing training in the Ponseti method, this non-surgical treatment that I've just described. We make sure that there are parent educators in the clinics to support the family through the treatment. They follow up, they make sure that the children come back and complete the treatment. Once we have made sure that if a kid shows up at a clinic, they're going to get high quality treatment, then we start to expand. We work on early identification and referral and raising awareness of the fact that clubfoot is a treatable condition and explaining to families where they can receive treatment. And then we increase the number of clinics across the country to make sure that families don't have to travel too far, because that's a real impediment for accessing care. At the same time, while we're doing all of this, we work very closely with the Ministry of Health and with any organizations working in the public health field to integrate our services into the existing infrastructure. So everything we're doing involves the government and with the goal of creating the capacity for that country to deal with clubfoot on an ongoing basis. Along the way, as we started to scale our work, we realized that there were some hurdles that we needed to solve. The very first of those, and I've left it sitting on the table, we developed a low-cost brace. So once the child has been treated for clubfoot, the tricky part of treatment is that they have to sleep in a brace at night for 4 years in order to prevent relapse. So the feet are fully corrected, they can run around, go to school, nobody would know that anything was wrong with their feet, but they do need to sleep in this brace at night. And one of the hurdles was that braces that are used in the US are very expensive. They're very easy to use, they're more attractive, but they cost between $360 and $1,000. We produced a new brace, cost us $20 to produce it. It has all the functionality of the nice, expensive American brace, but it costs a lot less. So we're using that. We did that with the Stanford D School. and with Clark's Shoes, who've been wonderful partners in that. The next innovation that we developed was to improve our data collection system. And I'm sure there's a lot of you who struggled with this, but we, from the beginning, collected data on every single child that we treated and tracked their progress through treatment using a PC-based system. We've now replaced that with a beautiful mobile app. It's been rolled out in, I think, about 50% of the clinics that we work with, and will be complete by June of this year. We worked with Damagi on this. It also allows us to communicate back to the parents through SMS, to remind them about appointments and give them encouraging messages throughout the treatment. And then finally, we've started to put the training materials onto a digital platform, working with Boston Children's Hospital, so that people can access that care ahead of time. And we've also included in that a 3D simulation of the clubfoot, which is up the top there, and I think the video might run very quickly, possibly, yeah, which is going to help teach people the manipulations that are involved in the treatment. What have we been able to do so far? We've helped, since we started 8 years ago, 35,000 children access care, and we're working in 26 different countries, about 150 different clinics that we support worldwide. We continue to grow both within the countries by adding throughput in the clinics that we're working with, and by going into new countries each year, probably about 2 a year planned going forward. What are we trying to do? We believe that we can end the disability caused by clubfoot globally. We've been working with a group called the Global Clubfoot Initiative, which is a umbrella organization that all of the people working in clubfoot are a member of. And together with them, we worked out what it would cost to build programs that will ensure every single child can access care in low and middle income countries, with an increased investment going up to $12 million a year, so $160 million over 15 years. We believe we can get every one of those children treated up to 70%, so it would be about 1.2 million additional children treated. Not only would we treat that number of children, but we would leave behind the capacity for every country to deal with clubfoot on an ongoing basis with a fully functioning national program. So the wonderful thing about clubfoot is this is a problem we can solve. This child who's running was born with clubfoot. Again, it cost $250 to treat him. He will go on to earn $120,000 more because he is able to go to school and work than if he was disabled. If you take that on a macro level, if we could invest that $160 million, it would generate $115 billion of additional revenue, as well as letting kids like this run, play, and join in with life. So that's what we're up to. I would welcome feedback, and hopefully you can grab one of us over the course of the next 2 days and share your ideas, questions, and input with us. Thanks very much.